So today we want to talk about heart health and heart disease. We're going to talk about a few different things. So we're going to talk about the physiology of it, so what heart disease comes from, what actually is heart disease. We're going to talk about how to prevent heart disease, how heart disease is treated, and hey, maybe we already have a little bit going on in our heart. We have a little plaque buildup. What can we do at this point to try to improve rather than just medications and treatment? First, I know you guys are familiar with Hatfield Medical Group, but let's just talk a little bit about who we are. So Hatfield Medical Group, we were founded in 1969, so we've been around a long time. And lately, over the past year, we've been growing and expanding a bit more. We currently have 9 locations here in the East Valley and are still expanding. So planning to have a couple more here by the end of the year. We're a primary care group focused on our Medicare patients. So we're really trying to focus on Medicare patients, keep you healthy, keep you safe, keep you out of the hospital. We really want to provide quality, compassionate care to our patients at every visit, every day. So as Tom was saying, we try to give a little bit more time with our patients. So we try to intentionally limit our patient load to 3 patients an hour, so we can spend a little bit more time with you. And sometimes that might not even be enough, so we might need to see you back a little bit sooner just because medical issues become complex. We want to spend a little bit more time to help cover this. We don't want you to feel rushed. We don't want to rush through your health. We want to make sure we're really addressing everything that we need to. We provide good access to care, so we can usually get you in the same day or next day. I know sometimes as a new patient, we're booked out a week just since we're a new growing clinic. We're probably going to be having another provider here starting in the next month or 2 as well, just to help as we continue to grow and expand. So hopefully access to care hasn't been an issue for you guys, but we want to provide good access to care for all our patients. We also have brokers here on site often that can help with Medicare issues. So Medicare can be complex. I'm sure you guys have gotten bombarded with things in the mail about Medicare on, hey, which plan do I choose? They're trying to sell me this plan, they're trying to sell me this plan. We want to make sure we get you on a plan that's right for you, not on a plan that they think is right for you. So we have brokers here. We have Danae, who is our patient service coordinator that can help, or patient benefits coordinator that can walk you through maybe some of the benefits that you have on your insurance that maybe you're not utilizing. So maybe you have an over-the-counter benefit or a gym membership that you can utilize that maybe you just don't know about. So she can help you set those things up and just inform you about that, and then she can set you up with a broker if maybe your plan, maybe some of your medications cost too much money, and maybe they can get you on a better plan where your cost for your specific specialist visits or your medications can be a little bit lower for you. So we want to get you on the right plan that's right for you specifically, not that United or Humana or these companies want you on. We want to get you on something that's good for you. And we're accountable for patient healthcare outcomes. So that's how we're able to grow as a practice is we do well when we're taking care of our patients. So we're not trying to see 50 patients a day. That's not really how we're making money as an organization. We have specific contracts with insurers that say, hey, if we take good care of our patients, that's how we get reimbursed. So that's what we're really focused on, is making sure we're doing preventative care and keeping you out of the hospital and keeping you healthy. Any questions that you guys have about the organization in general before we get started here? All right, so this class is going to last about 30 to 45 minutes. Obviously, our discussion today is not necessarily specific for you, but just in general. Definitely if we're going to talk about changing your diet or exercise routine, you'll want to talk to your provider specifically to visit so we can go over your medical issues and see what's right for you. And this is a safe zone. If you guys have questions, be sure to ask questions. Yes?
Can I interrupt just for a second? Do you have a list, like the first thing that you showed there, what you're here for? Do you have a list like that I can put on the bulletin board?
Yeah, we can get one for you. I can have Tom print that out.
Okay.
Yeah, definitely. Okay, so heart disease is a lifelong condition, but there's a lot of things we can do to control it. And we can improve heart disease to have you live a long life and a rewarding life as well. So we're going to talk about some myths for heart disease. We're going to talk about the basics and the physiology of heart disease and some warning signs to watch for as well. So that's a big important thing that we need to go over. And then we're also going to talk about the treatment of heart disease. So a couple things, couple questions. So true, false questions. The only way to treat, oh yeah, we got our paddles out, right? So the only way to treat heart disease is by taking medications or having surgery. Is that true or false? False. So there's a lot of other different methods, and we're going to talk about that today on what we can do to help treat that. Okay, if you have heart disease, you should be doing physical activity. Should you be doing physical activity, yes or no?
Oh, yeah, you should.
You should, yes. We want to make sure you're staying active, and we'll talk about that a little bit today. How about this one? I will know I'm having a heart attack because I will have chest pain.
False. False.
False. So chest pain is one of the most common signs, but is not definitive. So there can be other signs, and we'll talk about those concerning signs today. All right. So this is some of the things we just talked about. So you can help control heart disease and lifestyle. Heart disease and your lifestyle is key for turning the tide. So changing your lifestyle if you do have heart disease is important. Chest pain is a common symptom, but a heart attack can also cause some other subtle symptoms. So we're going to talk about those. And then an exercise program approved by your healthcare provider is safe and beneficial for your health. So that's going to be something that's really important. Okay, so let's talk a little bit about how the heart works. So this is the heart. Deoxygenated blood comes in through the vena cava into the right atrium, and it gets pumped out through the pulmonary artery to the lungs. So it goes this way, gets oxygen, and it comes back in the heart on the left side into the left atrium, gets pushed out through the left ventricle after it's oxygenated, and then goes through the aorta as it gets spread throughout your body to deliver that oxygen to your tissue. So when we're talking about heart disease, it's not necessarily related to these vessels or these ventricles or atrium. What it is heart disease is a blockage of your arteries in the tissue that supplies in all this muscle tissue of the heart. So that's what heart disease is blockage of some arteries that supply the oxygen to make this powerhouse work, basically. So, a heart disease is a reduction of blood flow. So this prevents the heart from getting much needed oxygen nutrients. So as you can see here, so this is maybe some mild heart disease, some moderate, and then severe heart disease. So there's going to be a lot of decreased blood flow the worse it gets, which means less blood will be going to those tissues, which means tissue can die. So if we have some severe heart disease, you get a blockage there, which means less blood flow to the tissue, which means some of that tissue in the heart might actually die and not work correctly. So complete blockage is when it becomes completely blocked and a person may have a heart attack. You can also have a heart attack if we have some moderate disease, but obviously the worse it gets, the more likely you are to have a heart attack. And this buildup of plaque, so just to go back on this, the buildup of plaque is often related to cholesterol. It's also related to inflammation. That's another thing that's important to understand. We'll do a doc talk in the future about high inflammatory foods that we can have in our body and foods that we need to avoid to decrease inflammation. Because part of this cascade of developing this plaque involves inflammation. So we want to make sure we're avoiding inflammatory foods as well. Okay, so some risk factors for heart disease. So some of these are controllable, others are not. So age, uncontrollable, but obviously with age we develop a little bit more calcium buildup, a little bit more plaque buildup just from cholesterol in our body. High cholesterol, so the higher the blood cholesterol, the more cholesterol there is available to stick on those walls of those arteries. Smoking, this one is smoking cholesterol, those are controllable. So smoking causes more inflammation and increases your risk significantly for heart disease. So that's one of the main things you can do. The main controllable things you can do is if you are smoking, to stop smoking. Gender is uncontrolled, we can't change that, but males have a significantly higher risk of heart disease than females. High blood pressure, so that's something that we can treat and can be adjusted. So making sure you're coming in for your regular checkups, that you're monitoring your blood pressure and helping keep that controlled.
But what number should you really be worried about when you take your blood pressure?
So the number is 140 over 90. So we don't want to see it. The studies have shown that if your blood pressure is higher than 140 over 90 on a regular basis, then that puts you at higher risk. So ideally, a perfect blood pressure is 120 over 80. So we'd want to see you closer to the 120
Okay.
over
When
80
you take
range.
your blood pressure, cardiac, set in both arms, I've been doing it.
Mm-hmm.
They're not the same.
Correct.
Which one should you really be worried about?
I would say probably the higher one. Yeah, so whichever one's a little bit higher, that's the one I would go
Would
on.
this one be, would your left one be higher since your heart's somewhat, not
Not
necessarily?
not necessarily. It's really based off of pressure, but your blood pressure is going to fluctuate for a variety of different things. When you're checking your blood pressure, it's important that you're sitting down and resting for 5 minutes rather than getting up, walking around, and coming sitting down. So oftentimes we'll have to recheck your blood pressure here in the office because, hey, you're a little bit stressed about the visit. We told you to come in for lab results, and then we just walked you back from all the way in the back of the office, and then we take your blood pressure away. So sometimes we have to recheck it. So just making sure we're rechecking it. We want to really look at averages as well. So if you're checking it at home, I would say, hey, check it. If we're concerned about it, we want to be checking it a couple times a week, writing it down, and then going over it at your visit. So other things is weight. So we want to make sure we're watching our weight, and we'll talk a little bit about that today. Family history. So we can't change our family history, but if you have a significant family history for heart disease, we want to make sure we're watching you a little extra close. Maybe you aren't having a lot of symptoms, but maybe we should get you in to go see a cardiologist for a stress test if you have a significant family history. Do you have a question?
No.
Oh, okay, sorry.
Good, like that.
And then activity. So we want to make sure we're not living a sedentary lifestyle. We want to make sure we're staying active and being active. And then the other thing that's a significant risk factor is diabetes. So having diabetes significantly increases your risk for heart disease. It's a similar risk as if a patient had just had a heart attack and got out of the hospital. Someone with diabetes would have that same risk. So we want to make sure we're taking your medications. So having a cholesterol medication on board will significantly reduce that risk.
That inactive lifestyle is really tough with this coronavirus going on.
Yes, so we got to find other ways. Yeah.
I thank God for Hatfield.
Yeah, so we got to find other ways to make sure we're staying active. Sometimes it's just being out in the neighborhood when it's cooling down, going for a walk, that type of thing.
Clean the house.
Yeah, just doing
Clean
other
the
stuff to
closet,
say.
clean the drawers.
Hey, getting up and moving, whatever you're doing, I want to just make sure you're getting up and moving. But hopefully here, as the weather's starting to cool down a little bit, maybe a little bit more here in the future, we just want to make sure we're out there being a little bit more active. And then we may even need to talk to our benefits coordinator to see if we can get you silver sneakers, and maybe you can find a time to go to the gym where there's not a lot of people in there. But yeah, we still need to be careful with COVID around as well. Okay, so treating heart disease. If you've been diagnosed with heart disease, your healthcare team may recommend a multifaceted treatment approach. So one of the things we talked about was making sure you're taking your medications. So cholesterol medications is really one of the mainstays of treatment. There's a lot of different cholesterol medications, but that's one of the main things that we do to help stabilize these plaques that develop and to help decrease that plaque size by taking cholesterol medications. Eating a healthy diet, and we'll talk about that a little bit today as well. Maintaining a healthy weight, finding out about medical procedures if they're necessary, being physically active, and then managing stress and depression. These are things we're going to chat about right now. Okay, so if your provider prescribes medications, take it as prescribed. So at your visits, bring a list of your medications to your appointment so we make sure that we're both on the same page, that yes, maybe your cholesterol medication didn't get refilled, but we think you're taking it and you're not sure if you're taking it. We want to make sure we have an updated list of your medications at your appointment. Using a reminder system, that can be important as well. So maybe you're not taking a lot of medications and you just have your bottles in your cabinet and you're forgetting to take them often. So use a pill box. So those pill boxes can be really helpful. They have A and PM pill boxes, other different reminder systems, setting alarms on phones. We want to make sure you're taking your medications as prescribed. And then don't stop taking your medication without talking to your healthcare provider. So, for example, blood pressure medication. Blood pressure medication, lasts in your system for about a day, and then it goes out of your system. So if you're taking it every other day, your blood pressure is doing good, then spiking up, then doing good, then spiking up. And that's going to have a significant impact on your heart health. Cholesterol medication, it's not going to be as dramatic of an increase if we skip a day with that, but we just want to make sure you're taking your meds on a regular basis. Treatment options. So there is a lot of medical procedures that can help ease chest pain and clear these blockages. So let's just talk about some of these. Hopefully we don't have to do these. That's not what we want to do. We want to prevent this, but let's say we do have some buildup already, then there's a few different things we can do. So stents, I'm sure everyone's heard of stents. So a stent is a wire mesh tube that helps prop open an artery to improve that blood flow. So if you've had a stent placed, then they'll often give you a blood thinner because we don't want any of those platelets, any of that plaque buildup to build around that stent, since it's a foreign body. So it's not something that your body's used to having in there. So we have to give you medication to prevent extra blockages because you have that stent. So it's important to keep taking those, but that's one of the treatment methods. Angioplasty, so they insert a small balloon and inflate it and kind of pop that vessel open. So that will increase that blood flow. Plaque removal, so they can remove some of that plaque as well by cutting or vaporizing it out. That's not done as much as it was in the past. Oftentimes they're able to do stents where previously they've done it, these plaque removals. And then bypass surgery. So sometimes they can't get a stent in there, they can't remove that plaque, and they'll have to do that bypass surgery that you guys have heard about before, where they have to do open heart surgery. Essentially, that's what that is. So any questions about the procedure section? Okay, so diet. We want to make sure that we're eating a healthy diet. So we want to make sure we're having the right types of fats in our diet. So we want to make sure we're avoiding trans fats. A lot of stuff, trans fats got a bad rap, luckily, and they removed them from a lot of different types of foods. We want to do healthy monounsaturated fats and polyunsaturated fats. So that's like canola oil, olive oil, and that can be found in other healthy things like avocados, olives, peanut butter, seeds, that type of thing. So those types of foods are helpful. Nuts, almonds, peanuts, pecans, cashews, and then polyunsaturated fats, other types of nuts are like walnuts, sunflower, corn, flaxseed, and then fatty fish, so fish oil as well. So those are all healthy types of fats. And then the fats that we want to avoid are saturated fats. So that's like red meat, coconut oil, dairy, so butter, cheese, ice cream, unfortunately, red meats. So these are all saturated fats that are bad types of fats for your heart. We want to make sure, another thing that we can do to decrease your cholesterol is increase your fiber intake. That's another thing you can do. So by increasing your fiber intake, as that fiber passes through, it collects some of that cholesterol and prevents it from getting into your bloodstream. So fiber is actually important for your cholesterol as well. Fruits and vegetables, those have a lot of fiber, so those are important things. And then limiting salt and added sugar. So simple sugars can cause increased inflammation in your body. So we want to make sure we're avoiding simple sugars if we can. And then limiting salt. So the reason we want to limit salt is because we want to make sure your blood pressure is staying controlled. That extra amount of sodium in your body can increase your blood pressure. So we want to make sure we're having a heart-healthy diet.
Don't you need a little salt like for the iodine?
Yes, a lot of the food already has iodine in it, but and a lot of our food already has this salt already in it as well. So iodine is important, but I feel like with nutrients today, it's already in a lot of different stuff and already included in some of our foods. But yes, some salt is important, but we want to make sure we're not overdoing it. Some of the processed foods that we have, if we're having any of those pre-processed foods, the microwave dinners, anything like that, usually as a preservative, they use salt. So and they use quite a bit of salt as well. Soups, canned foods oftentimes have a lot of salt. Okay, so if you're overweight, losing weight may help treat heart disease. Even losing a small amount of weight can improve your heart health. So when it comes to weight, we want to make sure we take that slow and steady approach. So I don't want people feeling frustrated if they're like, oh, I'm only losing a couple pounds a month. It's taken me forever to lose this weight. If we look at it in a longer term picture, hey, over a year, if you're losing 2 to 3 pounds a month, that could be 30 pounds in a year. That's pretty significant. But we just have to really stick to it and stick to our plan by having those a little bit decreased calories, so not those high caloric foods, so the butter, the ice cream, and having more fruits, more vegetables to decrease our calorie intake. And then we also want to make sure we're staying physically active, like we talked about before. So extra activity, that's another way to burn those calories to decrease that weight. And definitely talk to your healthcare provider about an exercise routine for you. What can I do? Maybe it's, hey, you're having a lot of joint pain. Is there something else I can do? Yeah, we can get you set up, do some water activities, some water aerobics, or get you doing a little bit of biking to help increase that activity. So talk to your provider about what you can do to increase your physical activity. So we can also talk to you about any limitations that we may have as well. Ideally, we want to aim for at least 150 minutes of moderate aerobic activity. So that's going to be walking at a brisk pace to get that heart rate up and going. And then the other important thing is doing something that you like. So that's really important as well. So if exercise is a chore and it's a big hassle and it's not something you like to do, it's a lot easier to not do it. So we want to make sure, hey, I like bicycling, or I like hiking, or I like swimming. Do something that you enjoy so it's a lot easier to continue doing it. And this is another very important part of heart health, is actually your emotional health and stress levels. So we want to make sure that we're helping manage your stress. You have some stress reducing activities at home that you're doing some meditation, some yoga, some reading, some drawing, things that you like to do to help manage your stress. Sometimes these high levels of stress can cause heart attacks. If you already have some risk factors, these things can really push things over the edge to cause some problems. So make sure you have a good support system. Make sure you're talking to your family and friends about things that you're going through to help manage the stress. Make sure you're coping with stress in a proper manner. So we don't want you coping by smoking, obviously. That's going to make things significantly worse for your health, or having lots of alcohol. We want to make sure we're limiting that as well. So 1 to 2 glasses a day is okay, but if we're excessively drinking, that's going to be causing some problems. If we're having issues with depression, make sure you seek help. So you can always come talk to your provider about that. Depression's a common thing, and we want to make sure we're addressing that, because your emotional health is just as important as your physical health. And then take it one day at a time too. So if you're feeling stressed, if you're feeling overwhelmed, don't focus on all the stuff you have to get done. Take it one day at a time. Make a list of things that you can do, so you can get caught up over the next week, over the next month, to get those tasks done and deal with those issues. All right, so warning signs of a heart attack. This is very important. So chest discomfort, chest pain. So it's not always chest pain. Sometimes it's chest discomfort, chest tightness. People feel like something's sitting on their chest and they just feel really tight. So that is obviously the most common symptom, but not always the only symptom, and it's not always a symptom as well. So discomfort in other areas of the body. So sometimes people experience this left-sided neck pain or arm pain. Sometimes in females, it's more kind of epigastric pain. So in the upper part of the stomach, they feel a little bit of pressure, and you might think, oh, maybe it's just a little heartburn. But it's going to be more pressure that people feel. And if it's something where it's like, oh, I haven't had anything, I'm feeling uncomfortable, and then I'm also feeling nauseous and lightheaded and breaking out in a cold sweat, those are concerning signs. Yes?
I have episodes where my heart beats really hard and fast, and then my jaw hurts.
Yeah, so those could be signs, that potentially could be signs of maybe some decreased blood flow, but not necessarily a heart attack. So I think it would be a good idea to make sure we get an EKG going to see if there's anything abnormal looking on the heart, to see if we need to get anything taken care of. It would also be good to check, to try to figure out what's happening at those times as well. Sometimes you feel like your heart's beating when you're feeling stressed, when you're feeling anxious, that type of thing. And then we also want to make sure that your pulse isn't going too high. Sometimes it can be a different type of heart issue hey, your pulse is going up really high, and your heart's just beating really fast, that might be another issue going on. So like atrial fibrillation or rhythm abnormality.
How much stock do you doctors put in lifeline testing?
In lifeline testing. So that can be really beneficial. We don't refer out to lifeline a lot. We refer out to our cardiologists and stuff.
Yeah.
But we want to make sure we're getting that preventative care done. I think lifeline, what's their cost? Do you guys know their cost for the testing that they do?
Depends on how many of the tests you take
Yeah,
that
so-
they offer.
Yeah.
But I have an appointment with Dr. Hahn tomorrow, and I was in hopes I'd get the results back from Lifeline, which was about a week and a half ago, but I haven't gotten it yet. Hopefully it'll be in today's meal, but I'll share that information
Yes.
with Hahn.
Definitely. If you get that stuff done, please share that with us. That's extra information that we would like to know to see if further follow-up testing is needed. But
Well, I didn't know how much stock you doctors put in that information from Lifeline, that's why I asked.
yeah, I mean, it's very beneficial. It
Okay.
can be very beneficial for you and for that cardiac workup. We also have other blood panels that we can do here in the office. So as we talked about the different types of, let me pull that up here. There's different stages of heart disease. So there's some blood testing that we can do here in the office. It's like a cardiac risk panel. And it's through SonoraQuest. We're working with SonoraQuest closely on this to be able to run this test so there's no out-of-pocket for you. So we're currently doing it for our Medicare patients only. And it checks about 9 different tests. And it ranges from, they look at biomarkers at every individual level. So if there's a little bit of plaque development or some inflammation, there's some testing that we can do for that that's included in that panel. It'll show, hey, your high sensitivity C-reactive protein level is elevated. Maybe there's a little increased inflammation in your body right now. We need to work on some low inflammatory foods and some other things we can do to decrease the inflammation.
So what is that test called?
It's a cardiac inflammatory panel. And then also it shows, hey, we can also do some biomarkers that show you have a very significant plaque, and that plaque is at very high risk for rupture, and we are very concerned about this. Let's get you over to the cardiologist right away so they need to do an angiogram to try to see where this is. So there's a lot of different biomarkers that we can test these days to see if there is, where we're at in the spectrum basically. So it's not a perfect picture, but it gives us a lot of helpful information to determine where we're at on that risk profile, if we already have some plaque buildup, if it's plaque buildup that's worsening. So it's kind of a whole spectrum of heart disease basically. So that can be something that you can talk to your provider about, and something we do here in the office, and we're working with SonoraQuest closely on to make sure we're preventing people from preventing heart disease basically, and helping treat heart disease. So let's see, so chest discomfort in upper areas of the body, we talked about that. Shortness of breath, so if you're feeling short of breath, or if you're doing activities, so if you're doing your walk or you're doing some bike riding and you're feeling a little bit short of breath, that can be a sign of a heart issue as well. But usually people have some difficulty breathing associated with some chest discomfort, so that's a warning sign. And then these other things that we talked about, nausea, lightheadedness, oftentimes diaphoresis, so breaking out in that cold sweat, and maybe you're not doing anything or not doing anything significant. That can be a concerning symptom. So if you have these symptoms, that's not something that you want to say, hey, I need to call and get an appointment. You need to call 911 so they can get you evaluated. Oh, I'm having some chest discomfort, I'm having a lot of pressure, I'm breaking out in a cold sweat. That's a concern. We don't want to wait on that. We want to get you checked out right away to help prevent issues. All right, so any questions about anything that we talked about today? We talked about weight loss, we talked about the anatomy and physiology of the heart, we talked about the physiology of heart disease and plaque buildup. We want to make sure you're managing your stress at home, managing any depression issues that you might be having, so we can make sure to get that under control, because that's a significant risk factor as well. Talked a little bit about the healthy foods, so we want to make sure more fruits, more vegetables, more fiber, more of those healthy fats, those avocados, olive oil, and avoiding those saturated fats, so the dairy, dairy, butter, ice cream, that type of stuff, and then red meats, trans fats. So a lot of different things we went over. But any questions that you guys have about that right now? Yes?
What's the difference between a stroke and a heart attack?
So a heart attack is a lack of blood flow to the heart. A stroke is, there's a couple different types of stroke, but essentially a stroke is a lack of blood flow to the brain. So that's what that is. So you can get some plaque buildup potentially in the brain, and that plaque buildup, when if there's a decrease of blood flow going to the brain, then those tissues in the brain, that brain tissue does not get that oxygen it needs, and that tissue can die, and that's what a stroke is. And a TIA is like a mini, kind of like a mini stroke is what people call it, where there's a decrease in blood flow, but it's not enough decrease in blood flow where it causes long-term damage, but it's just kind of temporary. So very much related to our conversation that we're having today. If we're talking about preventing heart disease, it's directly preventing strokes as well. So blood pressure is another important thing that can cause issues with strokes, and is very much related to strokes. So any other questions that you guys have today? Well, thank you very much for coming in and participating with our discussion today.